this session, we're going to focus on the practice of self-compassion, another tool that can boost resilience. Like mindfulness, self-compassion or compassion practice has its origins in Eastern traditions. Over recent years, many researchers, including 2 American psychologists, Kristin Neff and Chris Germer, who developed the Mindful Self-Compassion Program, have studied this practice extensively. These researchers have found that the practice of self-compassion significantly reduces levels of anxiety and depression and boosts resilience during times of stress. This tool may be particularly useful for people who tend to strive for excellence and even perfection, as many in the healthcare field do. People who dedicate themselves to help others in high-stakes situations, who don't want to make mistakes or feel they can't afford to make a mistake, are prone to being very hard on themselves. But it turns out that self-criticism is not always helpful. Rather than pushing a person to make fewer mistakes and perform better, self-criticism often interferes with the ability to think clearly and calmly and can lead to more mistakes, as well as anxiety and other types of distress. The fundamental idea behind self-compassion practice is that instead of being hard on ourselves when something goes wrong, we treat ourselves as we would treat a friend in the same situation. The central idea is that through this practice, we learn to be a good friend to ourselves when we need it, to become an inner ally rather than an inner enemy.
You know, if my friend was saying this to me, I would say, look at everything that you've accomplished. Look at everything that you know how to do. Look at everything that you're able to do and the way that you were able to support these families and these patients and provide this care and critical care. Like, look at everything that you do know, because there's always going to be uncertainty. But, you know, I think there's a healthy amount of fear in being a healthcare provider, to be cautious at all times, to be always advocating for your patients. But I think that having that ability to be nicer to yourself, I think comes easier to me when I put myself in the shoes of my friend and say, I wouldn't speak like this to anyone that I care about, so why should I speak like that to myself?
So I think that high achieving and intelligent healthcare workers have a tendency to compare themselves to each other, especially when we work alongside such talented and accomplished people. And so I find that I can be hard on myself when I'm doing that, comparing myself to others. And I think everyone does that, and people don't often talk about it. And if I were to share those thoughts and worries with a good friend, I know that they would remind me of what a mentor of mine, Hassan Bazari, would have said to me, which is that you should not compare your insides to other people's outsides.
Let's try an exercise together to see what relating to ourselves with compassion might look like in practice. This exercise has been adapted from Drs. Kristin Neff and Chris Germer's Mindful Self-Compassion Workbook, and it's called a Self-Compassion Break. First, let's take a pause. And during these next few moments, all you are doing is this exercise. There are no other demands on your attention. Bring to mind a situation in your life, could be about the current pandemic or something else that is causing you some stress. What are the thoughts that are present around this situation? What are the feelings you're experiencing? How is it showing up in your body? See if you can turn towards it and allow the discomfort or whatever is here to be here without pushing it away or feeding it. You might try labeling what's going on with something that fits your particular situation. You might say, this is stress, or things are really hard right now. We are bringing our mindful awareness to observe and label the situation we are in, not judging it as good or bad. Now I'd invite you to say to yourself, I'm not alone in this. We are bringing our awareness to the fact that we are connected and not alone in the struggle during this time. You can use any language here that's right for you to convey this sense that we are in a shared human experience. And now I'd invite you to say to yourself, may I be kind to myself. You might ask yourself what you need to hear in this particular situation to relate to yourself with kindness. It could be, may I be patient? May I be brave? May I accept myself as I am? Whatever speaks to you in your particular situation. Sometimes it helps to put a hand on your chest or adopt a soothing touch that feels right for you. Something that cues us into the fact that we are in need of kindness and compassion during this time. If you're finding it difficult to think about what a compassionate response might be, you might think about what a good friend or a loved one might say to you in this situation. What might they do? Really call to mind how it feels to hear these words, to think about what it feels like to have a good friend or loved one say these things to you. As we close, again, bring your attention to your body and your awareness of what is right now. Again, taking that pause to check in before letting go of this practice, knowing that you can return to it at any time.
There are some things that make it hard to be compassionate towards ourselves. We might think, this will make me weak, selfish, or lazy. Or if I let myself off the hook, I'll get away with murder. I need to be hard on myself when I mess up. Or we may feel like self-criticism is what drives me to succeed. But in fact, studies have shown that self-compassion does not interfere with achieving our goals. It turns out practicing self-compassion actually allows us to be more efficient and productive because we're not spending as much energy on self-critical thoughts of guilt or shame. We're better able to bounce back from mistakes and move forward. It's also important to remember that treating ourselves with compassion and kindness actually helps us to be more compassionate towards others. So if you're having trouble saying these things to yourself, imagine that a dear friend or loved one is having the same problem as you. What would you say to that person? And now see if you can say something similar to yourself.
The thing I've probably been hardest on myself lately is not being a present parent because I'm so stressed out. So when my kid wants to sit down and do Legos with me and I'm irritated that she keeps saying mom because I'm trying to check the news on my phone, and then my mind will drift to what's going to happen to my family if something happens to me, that I can't even be present. So here I am worried about not having my family, but then when I'm with my family I can't enjoy them because I'm so nervous about what's going on. So being hard on myself and not being able to just appreciate what I have right now, that's difficult for me. And I absolutely know that a good friend or even God would be like, you're doing the best you can, you know? These are really hard times and you're doing the best you can.
Let's think again about Maria, the healthcare worker who was concerned that she had been infected with COVID-19 and had exposed others. She was likely feeling anxiety, guilt, and shame about this. If she were to feel some compassion for herself, she might see that she is in a very difficult situation and take a moment to acknowledge that what is happening to her is understandably very upsetting, and it's not truly her fault. Maria might also remember that in reality, we are all in this crisis together, and that the responsibility for solving this problem is not just on one person's shoulders. Any of us could be in exactly her situation. And then she might say to herself, as she would to a friend. Wow, that is really hard. You must feel awful. But it wasn't your fault. How could you have known? You were just doing your job.
This session focused on the tool of self-compassion and how it can be used to boost your resilience during times of stress, particularly when you're being hard on yourself or feeling overwhelmed. Please pause for a moment and ask yourself, when and how can I practice self-compassion? Next time you notice that you're being hard on yourself, can you take a step back and remember what you might say to a friend who's in the same situation? In closing, we want to also express our deepest appreciation and gratitude for all the work you've been doing on behalf of our community. Thank you for your service and sacrifices for all of us.